My family has a high risk genetic disease that is very rare and does not affect a lot of people. My grandmother and mother have both suffered from this disease. I have seen my mother rapidly decline throughout my life over the past 17 so years from this disease that many people have not heard about. This disease is called amyloidosis, and the particular section of this disease that my mother suffers from is the hereditary amyloidosis, which means that it is genetic and can occur in her children, her grandchildren, and generations above her. This disease has impacted my family in a dramatic way over the years and may affect me and my siblings in the future. We have had to see my mother go through many different treatments to help slow down the symptoms, although there is no cure. So we have hope, but we have to wait for the right time. To help you understand it better, I will explain the causes of this disease, the symptoms, and the possible treatments of this disease that some people may go through. Some of the causes of amyloidosis is when an abnormal protein called amyloid builds up in your organs and interferes with normal function. Some varieties of amyloidosis occur in association with other diseases, such as arthritis and other kinds of cancer. This can help cause the amyloidosis if it is not a hereditary type. AA amyloidosis, which is a type of amyloidosis, is usually triggered by inflammatory disease such as rheumatoid arthritis. So this type of arthritis can be known to cause the AA amyloidosis. The hereditary amyloidosis is caused by a protein in your liver that is abnormal. This protein is called transthyretin, also known as TTR. Some of the symptoms of amyloidosis can range and vary. You can have numbness or tingling and pain in your feet or hands, according to the Mayo Clinic, an enlarged tongue, skin changes, which means that people may get easily bruised from having amyloidosis, or other marks may show up on their body that usually would not show up. An irregular heartbeat and difficulty swallowing. My mother, a survivor of the hereditary amyloidosis, suffers from fatigue, loss of appetite, and joint pain. Some people may also experience some shortness of breath, kidney dysfunction, liver dysfunction, and other types of things that might not be normal. There is no cure for amyloidosis, but there are some treatments that people can follow if needed. A doctor can prescribe treatments to slow down the development of the amyloid protein and manage your symptoms. So some might be more effective than others. You just have to figure out what type of amyloidosis you have and if it will help it. People may have a liver transplant to treat the disease if you have a certain type of hereditary amyloidosis. It's very hard to find out which type of amyloidosis you have, as everything presents differently and there is no one known treatment for these types of amyloidosis. You also may have a kidney transplant if that is a type of thing that is causing your amyloidosis to worsen. New therapies can slow the production of the abnormal protein TTR, which is the transthyretin in your liver. Your doctor also might recommend a kidney, or they might recommend a liver transplant if your case is so severe that your liver and your kidney is not functioning properly, which is about 25% of function in your liver or kidney. Also, a heart transplant, which is a very severe case, may have to take place if your heart is becoming worsened from this disease. There are steroids that patients can take that doctors can prescribe that can also slow this down. Immunosuppressives may also be needed during this time, and there is chemotherapy that can also slow it down, but it will not cure you. I have explained amyloidosis, which is a rare disease that less than half of the population suffer from, and they may suffer from the hereditary type or the AA type. It just depends. I have showed the causes of this, and I have showed the symptoms and the treatments. of this disease. I hope this educates people on an amyloidosis and the different types that may occur and what to do if shown. Thank you.